after the UB67, nail matrix of the fifth pinky toe. So now I just apply the point, this point to be known as a K1. This point to be known as a K1 point on the opposite side of the Chai Yin, that is the UB67 point. Now we are stepping into the same point on the sole of the foot. We have the another location, that location to be known as a K1 point. Where exactly located? Now you understand, this is the web margin, the plantar web margin, then the end of the calcaneal bone. The entire region is divided into three segments. This is the upper 1 by 3rd, this is the lower 2 by 3rd, this 3 by 3/3. Now we understand, this is the upper 1 by 3rd, midway between the second toe and then third toe. Midway between the second toe and third toe, this point is located on the upper 1 by 3rd depression. Otherwise, you just squeeze this slowly. Once she squeezes or the flexion of the toes, then the highest point of the shoulder, highest point of the depression. So this point to be known as a K1. So while inserting this needle, ask them to take the long breath. Take the deep breath. So you just apply the full needle on the sole of the foot, because this point is very painful point comparatively to other points. Since the plantar, the fascia is there, that fascia you are inserting to the deeper level, that having the vasoconstrictor and vasodilatation effect, because once you activate this particular point, this is the opening point to the central nervous system, especially for the brain. So therefore, when you wanted to treat this particular point, make sure that you are treating towards the liver 3. So once you apply liver 3, that goes towards the K1 towards the liver 3 is advisable. In this way, we just activate for the numerous related, for the renal impairment or the kidney related disorders, or the patient having some kind of the neuropathy condition for the diabetes, but certainly we can use it for the day-to-day clinical practice. Then if the retention of the urine is there, urine is not passing, so that time also advisable to use this point. When the headache, oftenly coming headache, even that condition, the patient having the fainting, coma, shock, vertigo, giddiness, or the auricular related disorders, certainly we can use this point. Now second point to be known as a Rangu. Second point to be known as a, sorry?
Depth of the needling, sir?
1 chun full, even 1.25 chun depth also advisable, but however 1 chun is quite good. Now we are coming to the K2 point. How to identify? There are the two locations, I will tell you, keep it in the mind. One location to be known as a, this is the head of the first metatarsal bone in the depression. Now you can find this is called as a spleen 4 at the base of the first metatarsal bone, second metatarsal bone, so on. But at the junction of the black and white skin, this point to be known as a spleen 4. But this is the medial side of the cuneiform bone. This point is located is the K2. Now from here, 1 chun anterior to the K2 point, that point to be known as a Rangu, that is the K2. This is the one location. This is the one location is K2. Now the next location to be known as a, you touch and feel, this is the tip of the medial malleolus. From the tip of the medial malleolus, you come down, you can find the bone. Touch all of you, you can find the bone. So just below the bone in the depression, this bone to be known as a navicular bone. Anterior and inferior to the navicular bone, that bone to be known as a navicular bone in the depression, this point to be known as a K2. Now you just apply K2 deeper level. So this point to be known as a K2, right? So now we applied the kidney 2 point to treat for the various menstruation related disorders. By the way, K2 point is good point to treat for the pedal edema, leg edema, or the pedal edema or the ankle edema. By the way, if the patient having the hypertension with that edema also having even that condition, you can use the K2 point is advisable. By the way, the Dr. Hiroshi Nagata, so who is the Japanese doctor who identified this particular point, K2 point is good point to treat for all the throat related disorders, especially the tonsillitis or the thyroid related disorders can be treatable by activating the K2 point. Otherwise, if the people who are sitting on the very hot and warm water, that is the 40 degrees Celsius water, as much they can bear that, so they can place the both the legs till the ankle region. It covers the point. So therefore, this point, it covers the K2 point, is useful to treat for all the throat related disorders, speech related disorders as well. So hopefully we understand K2 for the hypertension and also for the pedal edema and also to regulate the menstruation. When the patient feels always is the low energy and lethargy, because this point is the grandson point of the K2 and then equivalent to the P3 and H3. P3 and H3, it strengthens, regulates the fire organ in our body. That means fire is good. Then you understand when the person is very blissful and happy, and then no vertigo, no giddiness. When the fire is deficiency, patient always feel is the low energy, fatigueness and giddiness, haziness, hallucination, so on. So therefore, however we apply K2 is equivalent to the pericardium 3. So therefore, pericardium 3 is the grandmother point, strengthened to the brain activities. So therefore, we can use as a K2 or the P3 is advisable. Now we are stepping into the kidney 3 point, which is the most imperative point to be known as a K3 point. You just apply. Now where is the need to palpate? You just place the finger. This is the tip of the malleolus. This is the tip of the medial malleolus. Anterior to that region, you just place it the hand. You feel some kind of the palpation, impulse. You feel that impulse to be known as a which artery? Posterior tibial artery. So you didn't puncture that region, that causes the problem. So anterior to that region, how you to identify that? Now where the point is located, this is the Achilles tendon, this is the tip of the medial malleolus, this is the anterior border of the Achilles tendon, and then tip of the medial malleolus, center this point to be known as a kidney 3. Now you just apply kidney 3 here. Exactly, kidney 3. Now anterior to the kidney 3 point, the artery is located. Where is the artery is located? Anterior to that, this region you palpate. From here it comes like this. You can find this artery is coming to the downwards direction, but that's the reason if you applied on the artery, so that time needle gets shakes, continuously it gets shaken, that indicating that you are applied on the artery. Patient also feel that some kind of the shock, right? So hopefully this is the grandmother point to treat for after the 55-60 years, but each and every woman and then men is required this point to strengthen to the overall health related to the reproductive system. But no doubt after that we required the energy. We required the energy called as a great essence to increase our stamina level. By the way, this point is good point because K3 is equivalent to the spleen 9. Spleen 9 is the grandson point, but K3 is the grandmother point. Therefore, to strengthening and regulating and controlling to the spleen and to motivating to the kidney in order to strengthen the vitality of the renal system, to flow of the chi. By the way, this is the great point to strengthen the knee, back and overall bone system can be regulated. But whenever patient is complaining, I have the back pain, that time you just insert this one needle. That will be really helpful to strengthen for the overall health, but especially for the back pain. Now K3 we completed. Even for the knee pain also advisable by using this point. The next point is, now we understand the another point is K4. Now I'll just mark it, this K3, K4, K5. Now you understand K3 is where is exactly K3 you understand. K4 is half tune distal and anterior to the Achilles tendon. Half tune distal and anterior to the Achilles tendon. This point is located. That is the K4 point is the luvo connecting point. You just don't apply that needle to the tendon, you just apply to the anterior to the tendon in the depression is advisable. Yes.
Oh, Motaji.
Good.
You're disturbing the class.
We are not able to
Now K4.
because of not.
K5 point is now one shown distal to this region. K5 point is located. Please apply K5 is the C cleft point of the kidney. Yes, superficially apply. Now another most important point K3, another location I'll tell you. From one shown distal to the K3, this point also one shown distal to the K5, this point also good point to treat for the kidney 3 point. Exactly, just I apply superficially. Now this is the K3 point, but this also K3, this also to be considered as a K3. By the way, this is the most imperative point to treat for the Achilles tendon related problem or the calcaneal tendon related or the heel pain. Once they wake up in the morning, the pathetic pain they feel, that even that condition, you remember if the patient is complaining as the calcaneal spur pain or maybe numerous reason to cause the pain. L5 vertebra causing the compression which causing the pain on the heel pain, you treat for the L5 vertebra back. The second reason is the calf muscles get a stiffness, it causes the heel pain, so that give the pressure to this region, the patient feel relaxation. The third reason to be known as a when having the this calcaneal bone spur, that excessive growth of the bone also leads to that condition, then you can use this point is good. The third is whenever the patient is complaining heel pain, you just apply, you just ask them to give the pressure on that region. Most of the time when the heel pain is there, the patient feel more sensitiveness on that region. More tenderness on that region. The once you give the pressure, ouch, this is ouch indicating I have the too much pain on that region, but she don't get the pain on the calcaneal region normally while walking, but once you give the pressure, the patient feel the more pathetic pain, that indicating that is the tender spot for the calcaneal pain. Keep activating every day, that would be advisable. The third category to be known as a once you do as a take the half liter of the water, Bisleri water, put it in the fridge and then take out and roll this, but you assume this is the water of the half liter, then you just roll this as a massage on the solar muscles, but this will be helpful to regulate if there is an inflammation is there on the heel region, so that time they can do that kind of the exercises will be useful once they'll get the relief for the heel pain as well. Now we are talking about the K6 point is the most important point to treat for the all the throat related disorders. Now you remember this is the tip of the medial malleolus. From here one shown distal midway between the two tendons. I told you what are those tendons? Flexor hallucis longus tendon and flexor digitorum longus tendon. So now you come down from here, but now there is a depression in between the two tendons, but these muscles called as a soleus muscles. This muscles called as a soleus muscles of the spleen meridian is located on the which muscle? Soleus muscle, right? These muscles are called as a below the soleus muscles called as a flexor hallucis, flexor digitorum longus muscles. These muscles will become here tendon. So therefore in between the two tendon, approximately one shown below that in the depression, apply somebody, this is called as superficial, you just apply, yes, enough. K6 point, but however that can go further deep, but she is not the patient, by the way, we don't want to give more pain to Jayashri, right? So now that is K6 point is for the useful for all the throat related disorders. Now come to the K7 point, so please you just all the needles you just take off slowly. How to remove the needles I told you. So once you get bleed, that also benign complication, need not to worry about it. Give the pressure to the skin region, then you just take off the needles professionally, that would be better. Yes.
Sir, K3 point is in the lower border of medial malleolus or upper border of medial malleolus, sir?
No, upper border of the medial malleolus. Which one? K3? No, I mean to say K3 two locations. Which location you are asking me?
In textbook, it is mentioned in upper border of medial malleolus, sir.
K3? Tell me the full location name. Full location you just read.
Yes, sir. Midway between the medial malleolus and Achilles tendon.
Okay.
But the picture is showing at the upper border of medial malleolus.
No, picture is showing, but anatomical location is important. Where is it located? But this is the tip, and then Achilles tendon in the depression is located. But however, you remember it's the tip of the medial malleolus. In the book, maybe they are placing the location slightly, it get differs. But however, anatomical location is important. Now we are seeing about the K7 point. Folio. Now, however, you just place it as a two thumb, you place it like this. This also to be known as a K7. Otherwise, you wanted to place it as a three fingers on the tip of the medial malleolus. Then, which is the finger is the index finger, that to be known as a K7 point. Now, K7 point, you just insert the deeper level, partially deeper level. This is the K7. Exactly which muscle? This is the hallucis longus muscles. Good enough. So this point normally will get some kind of the vibration we inserted. That means you are connecting to the nerve called as a tibial nerve. This is the posterior tibial artery, that is the different, but the nerve to be known as a tibial nerve. Once you apply the needle in that direction, see, got the vibration. Did you feel that vibration? That indicating that the entire, where you got that sensation till the toes. So till the toes she felt that sensation. That means properly we applied the needle, right? So patient should feel it that. So hopefully you understand this is the great mother point of the kidney meridian to strengthen the kidney system along with the K3 and then K7 and then K6. That means 3 points you remember: K3, K4, 7 and then K6. Kidney in and then kidney yang. Both the conditions can be activated. These are the 3 points in generally. If we wanted to give us a electrical stimulation to these points, always is good, right? Hopefully we understand K7. Then the K8 point is located half shown anterior to this point to be known as a K8. Yes, good. Now this is K8 anterior to that. Where is spleen 6? Again spleen 6 is located here, one shown proximal, but however K8 is anterior to this region. The K8 point joxin with the lower extremities can be treatable and regulated by the kidney 8 point is joxin. Now from here 3 chon proximal to that region, 3 chon from here, 3 chon proximal to this, and then 2 chon anterior to the border of the tibia. 2 chon, you place it 1 chon, again you place it another 1 chon to the from here border of the tibia. Otherwise you come from here directly and then apply on the muscles called as a flexor digitorum longus muscles. You just apply here this point to be known as a K8. But during the pregnancy, K9 point, during the pregnancy you can apply this point, but make sure that on the 3rd trimester is advisable. Even author has written on the 2nd trimester itself is applicable this point. After the 30 years of the French people done the research, based on that the heredity problems cannot convert to the female baby or the male fetus. So this point can be applicable for the overall genetic disorders cannot be transferred to the infant. So hopefully you've seen that K9 point is completed. Now the K10 point is located on the, now this is the most important point since it's also command point. Now let me see where this point is located. This is as a horary point. Now medial end, this is the medial end, this both are medial end, this is the lateral end of the knee. But now the medial end of the knee, the medial end of the knee, and also medial end of the popliteal crease. Medial end, this is the popliteal crease, is the crease where the UB40 is there. From here you come down towards the toe, towards the great toe, towards the great toe, towards the great toe. this 2. So you come down medial end of the popliteal crease midway between the two tendon. Here there are the two tendons are there, but these muscles, inside of the muscles called as a semimembranous, semitendinous muscles are there. Those muscles are large muscles. Then muscles slowly come down will become the tendon. So the tendon to be known as these two tendons to be midway between these two tendon, that to be known as a semimembranous, semitendinosus. This point to be known as a K10 point ingu. Now let me see where exactly is located. Give me 1.5 chun needle. So I just apply little deeper level so that the inside of the two tendons should reach that. Now I just use the 1.40 mm needle. Now further I try to find out the two tendons. Yes, two tendons I found it, and then I just inserting two tendons in between to deeper level. That has been gone. The 40 mm deep needle has been inserted. So is it too pain, Jayashri? Mild pain, right? But however, if the tendon you inserted, then the patient feels some kind of the severe pain, because tendon on the tendon is cannot go the whole needle, but in between the needle is passing. That means that has been gone to the 140 mm needle inside. This called as a horary point of the kidney meridian. So without disturbing to any other organ, definitely this point can be activated. This is the K10 point to treat for all the kidney related disorders, with non-problem, without non-problem. Patient is complaining the medial side of the knee pain, then you just apply this point. When the kidney stone is there, that time you can apply. Remember, anything the over function of the kidneys, anything overgrowth of our body, either in terms of the bone growth, anywhere the bone growth, ganglion or the calcaneal growth, or the here bone growth, somewhere is the bone growth over in this region, or the vertebra there is a growth is there. So anything is the overgrowth, indicating that is the excessive function of the renal system, which leads to that problems. Thereby we just reduce the kidney 10 point. Only 1 point is quite enough. We decrease the energy so that the bone spur or the excessive growth of the bone slowly will come down to the normal level for the span of 2 to 3 months time.